Hello, my name is LaDawn Yazzie, and today I'm going to share information regarding osteoporosis and arthritis. In light of National Osteoporosis Month, I'm going to provide you all with a presentation that is focused on two common but different disease conditions. My hope for today's presentation is to provide information so you'll consider an approach that will be beneficial for you, your health, and your loved ones. This discussion is recorded so you can access the presentation on San Ildefonso Health and Human Services Facebook page and the San I YouTube page. Please discuss what you learn with others so you can be well informed of the information shared in this presentation. So let's get started. The objective is that by the end of this presentation, you will have identified preventative measures for osteoporosis and arthritis. By defining osteoporosis, in the newsletter, the Senior Center newsletter, I included a breakdown of what osteoporosis means. So basically, if you break up the words, osteo means bone, porous means passage or pore, and osis is the condition. It has also been called porous bone. Osteoporosis is a disease of the skeleton shown to be the deterioration of bone tissue, which leads to the loss of bone mass. In the graphic, you see two bones, a healthy bone and an osteoporotic bone. The osteoporotic bone shows trabecular thinning. It is, you can see the darker circles or the dark space within the osteoporotic bone, which is basically the thinning of the bones. Native Americans have a high prevalent risk of osteoporosis at 11.9%, followed by Asians at 10%, the Hispanic group at 9.8%, white individuals at 7.2%, and Black individuals at 4%. There are no clinical symptoms of osteoporosis. Sometimes it can be identified with fractures. So somebody comes in and they don't realize they have osteoporosis until they have fine lines of thin fractures or broken bones. The primary factor that leads to osteoporosis includes age-related influences. It is usually found in older women who have no primary risk factors. Our body's natural ability allows us to build up new bone and cycles into break down old bone. This is called remodeling. You can see the bone remodeling cycle in the graphic here. At the top, what happens is the bones crack, they fracture, and then our body begins to rebuild and basically reabsorb what's been broken off. These osteoclasts come in to help rebuild the bone, and then it helps to kind of seal some of those cracks, and then it goes up into formation. And so it helps the bones to be rebuilt. So that's a process that we go through, and this can take place for up to a few weeks to a few months. And at approximately 30 years old, most people reach their peak bone mass and start to lose this bone mass that they've built up as they age. So it is important to educate young individuals so they're aware of the importance of building bone mass at a young age. And it's important to let them know and inform them so that they have more bone mass basically in the bank. The risk factors that have been connected to the development of osteoporosis includes hypothyroidism, parathyroidism, celiac disease, chronic kidney disease, and autoimmune disorders such as rheumatoid arthritis. So factors that increase a person's chances of getting osteoporosis. This can include having a small body frame, having a family history of the disease, abnormal, for women, abnormal menstrual periods, or having an early menopause, and then also the extended use of medications such as lupus, thyroid, or seizure medication, and then also consuming very little calcium, and then smoking and alcohol. What we can change, or those things that we can't change, are non-modifiable risk factors. They include, again, the history of having a fracture, broken bones as an adult, that increases your risk factor. Your ethnicity, older you are, the more likely you're able to have the risk factors. If you have dementia, or if an individual is female, these are non-modifiable risk factors. The modifiable, the changeable risk factors that we have the ability to change is smoking. If we have a high BMI, we're able to change that. If we consume little calcium, we have the ability to change that as well. Alcohol intake, we can reduce that. And then also educating ourselves about falls, repeated falls, and if we had inadequate physical activity, those are modifiable. Those things we can change. And then when we're talking about management of osteoporosis, this can include lifestyle change, which a lot of the times it's been identified that 30 minutes of exercise 3 to 4 times a week can improve bone mineral density. So that's beneficial. Many exercises have been shown to benefit bone health. This includes resistance strength training and a combination of exercise programs. Other ways to manage osteoporosis includes nutrition therapy. So increasing foods that are high in calcium and vitamin D foods. What happens is vitamin D strengthens the bones by helping your ability to absorb calcium. So they work synergistically. And here we have an image, a chart here of vitamin D and calcium recommended dietary allowances for both men and women. And then also you can see the food sources that we can consume to increase our vitamin and mineral intake. One more area to focus on is increasing knowledge about fall prevention and ways to prevent fractures. Now we move on to arthritis. Arthritis is known as joint inflammation, which is a disorder that affects the joints between two bones that meet. Arthritis is a condition that can impact the joints in areas such as the knees, the wrists, the fingers, the toes, and the hips, which this can cause pain, and it can make moving or staying active very difficult. The two types that we're going to talk about are osteoarthritis and rheumatoid arthritis. Osteoporosis or osteoarthritis is a painful degenerative joint disease. It starts when joints are injured over repeated overuse, eventually impacting and wearing away the cartilage that cushions the ends of the bones. Rheumatoid arthritis is autoimmune inflammatory disease. What happens is the body will attack its own healthy tissue and really kind of damage own healthy tissue. This enzyme destroys the lining of the joints, causing pain, swelling, stiffness, malformation, and reduced movement and function. Symptoms and causes. Symptoms can be different between the types of arthritis. They can include pain, redness, stiffness, swelling, tenderness, and warmth. The exact cause of arthritis is unknown, but those who may develop arthritis could be those who either have a family history of arthritis, have an occupation that puts consistent stress on the joint or have a certain autoimmune disease or viral infection. So preventative measures, some measures to manage the treatment of both conditions can range from including exercise that highlights stretching, strengthening, posture, and range of motion. Everybody's different, but by including low impact aerobics, swimming, Tai Chi, or low stress yoga can be beneficial. It's important to check with your primary care physician or your doctor to find out if a certain exercise is right for you. Lastly, looking at nutrition, there's little information to show how nutrition can impact or improve arthritis, but evidence does support that decreasing your risk factors for these diseases can improve your overall health. For example, low blood levels of vitamin D increases your risk factors of osteoarthritis and rheumatoid arthritis, where the chances of getting osteoarthritis gets 3 times faster in people with low vitamin D levels. Brightly colored fruits and vegetables that are high in carotenoids, such as orange, bell pepper, pumpkins, tangerines, and papaya, have been shown to decrease inflammation, which is beneficial for your overall health. Also, weight loss reduces stress on your bones. So one interesting fact that I found was that about 1 pound of body weight reduces the load on your knees by approximately 4 pounds. The message here that we want to think about is foods that increase your vitamin D are beneficial. They're good for your body, and increasing the consumption of brightly colored fruits and vegetables is very beneficial, in particular, the foods listed here. Thank you for joining me. I hope you've learned something today. Have a great day.